Hello everyone, how are you all doing? I am Dr. Bindhu, Senior Consultant, Obstetrics and Gynecology at Apollo Hospitals, Navi, Mumbai. So, as you all know and you see nowadays that pregnancy bleeding, that is especially in the first 3 months, is relatively very common nowadays. So today I am here to tell you what are the causes of early pregnancy bleeding and whether it is a real matter of concern and when to approach your doctor and what are the tests offered and how do you treat it. So, early pregnancy bleeding occurs in 15 to 20% of all pregnancies and is now very common. First of all, I would like to tell you that it need not be always a matter of concern, but of course sometimes it can be alarming. So it is always better that once you have this pregnancy bleeding, to consult your doctor and take assurance or treatment from them. Okay, so what are the causes of early pregnancy bleeding? There is an entity called implantation bleeding. That is, as you all know, the embryo, when it is formed, it gets attached to the lining of the uterus or the womb. So when this pregnancy is getting attached to the lining of the uterus, it can erode the blood vessels over that area. As you all know, pregnancy is a very vascular condition. So it can erode the blood vessels of that area and causes bleeding. Usually it is a mild spotting or bleeding and it occurs in the first 5 to 6 weeks of pregnancy. And it is of no alarm and usually it disappears within a few days. Now the second cause of early pregnancy bleeding is miscarriage, which we will have to be concerned or it is a cause of alarm. So usually women who are tending to miscarry usually have some abdominal pain or cramps, and this pain can be coming very often. It is usually felt in the lower abdomen and it can go to the back and into the legs also, and the bleeding will be a little more. So it is when you experience these symptoms, sometimes you may get even tissue coming out through the vagina. So it is always better to consult your doctor when you are in doubt and don't ignore this symptom of early pregnancy bleeding. Now, there is another thing called the ectopic pregnancy. That is, when the pregnancy is developing outside the uterus, that is in the fallopian tube. As you all know, pregnancy or the fertilization starts in the fallopian tube, and the fertilized embryo or the fertilized egg will move down and get attached to the womb. Sometimes this pregnancy gets stuck in the tube and starts developing there. That is called ectopic pregnancy. So this kind of pregnancy is very rare and happens only in 3 in 100 pregnancies. But it can cause these symptoms like spotting or light bleeding, or abdominal pain can be there. The person can have lightheadedness, dizziness and difficulty in urination or bowel movements also. So it is always better to consult a doctor to know about this condition. Now, another entity is called the molar pregnancy, which is an abnormal type of pregnancy where the pregnancy as per se does not develop and it grows into some grape-like structures in the womb, and it is called a molar pregnancy. So it is an abnormal pregnancy and needs to be removed. The women may have increased nausea, vomiting, and also the uterus will be enlarged more than usual. Then after this condition, there are other things which can be there in the neck of the womb or the cervix, which can also cause bleeding. As such, in pregnancy is highly vascular or more of blood vessels develop. So the neck of the womb is vascular and sometimes bleeding can happen when you attempt sexual intercourse or even like that. So this can be a cause of early pregnancy bleeding, that is the highly vascular cervix. Then you can have some infections like sexually transmitted diseases. They can also cause this early pregnancy bleeding. Then there are some growths, or we call it polyps, or sometimes the uterus that is around the mouth of the uterus, that is called the cervix, and also there can be some ulceration which can cause this bleeding. So I now enumerated all the causes of early pregnancy bleeding. So this pregnancy bleeding can happen in the second and third trimester also, which of course can be quite alarming. It can develop due to the placenta or the afterbirth developing low, that is, it is getting attached close to the neck of the womb, or the placenta can also get separated from the uterus wall, that is called abruptio placenta. The previous condition which I said, the placenta developing around the neck of the womb, it's called placenta previa. Then of course bleeding can be a sign of preterm labor, or it can also due to a condition called vasa previa. That is again the blood vessels of the baby, that is umbilical cord blood vessels getting attached to the membranes, or that is rather than into the placenta, and it can break and cause bleeding. So what to do when you experience early pregnancy bleeding? First of all, don't worry, don't panic. Note how much the amount of bleeding you are having, and you wear pads, and so that you can be able to tell your doctor so how much pads you change, whether you are changing frequently, or see whether any tissue is coming out through the vagina, whether you have any abdominal pain associated with it. Then you contact your doctor as early as possible. So then the doctor can guide you further. So she or he may advise certain tests upon you. They may examine you, they may examine the neck of the womb, that is, they may examine internally also at times, and also they will suggest an ultrasound. The ultrasound can tell you most of the times the cause of bleeding. Sometimes the pregnancy hormone test or beta HCG may also have to be done. So once the doctor identifies the cause, she or he may suggest certain treatments for it. So complete bed rest most of the times is not required, but of course restricted physical activity should be there. You should avoid travel, avoid strenuous exercises, and the medications which are prescribed by the doctor. Sometimes they may suggest progesterones, which are the support medications for the pregnancy. In most of the times when ultrasound shows a pregnancy sac with the baby's heartbeat seen inside the seen in the pregnancy sac, that means 90% of the time you are unlikely to miscarry. That is, you will have there is a chance of getting a good and healthy baby in 90% of the times if you see a heartbeat in the ultrasound. And also you have to inform your doctor whenever you have certain alarming symptoms. So first of all, don't need to worry or panic when you have any symptoms which are out of like what your normal pregnancy symptoms, like vomiting or any other symptoms. If you experience any other symptoms in pregnancy, please contact your doctor as early as possible. He or she is there to guide you throughout your pregnancy, and you can have a very successful and fruitful pregnancy. Thank you.